Club of Portland's Friday Forum. I'm Courtney Nelson, president of City Club. For 100 years, City Club of Portland is where civic-minded people come together to make Portland and Oregon a better place for everyone to live, work, and explore. We're gathered at the Sentinel Hotel today, along with all of you listening on OPB Radio or viewing on Portland Community Media or YouTube. The generous support of City Club's corporate and media partners enables us to put on the state's best civic programs week after week. Our media partner is Oregon Business Magazine, and our current Friday Forum sponsors are Chevron Corporation, Echo Northwest, Morel Inc., Northwest Natural, and Vacasa Vacation Rentals. Please join me in thanking them. And now on to our Friday Forum program today. Our topic is Portland Fire, the bureau that works or does it? We'll be exploring this topic and centering on the changing nature of calls entering the bureau. With the Fire Bureau serving as first responder to medical calls, our panelists will discuss how such calls are currently handled and the possible strategies for going forward. Our first panelist is the City of Portland's Fire Chief Mike Myers. Also joining is Alan Ferschweiler, President of the Portland Firefighters Association, Joanne Fuller, Director of Multnomah County Health Department, Ed Blackburn, Executive Director of Central City Concern. Our moderator today is Cheryl Myers, Chief of Staff of the Oregon Higher Education Coordinating Commission. Portland's new Fire Chief, Mike Myers, was sworn in just a few weeks ago after earning a reputation as a progressive industry-leading fire chief. With more than 27 years of experience, Myers has demonstrated an innovative approach to complex safety and wellness issues facing communities. We welcome Chief Myers here today in his first appearance on the City Club stage. Alan Ferschweiler, oh yeah, please, thank you. Alan Ferschweiler is the president of the Portland Firefighters Association. He has worked for the Fire Bureau since 2001 and is assigned to the Emergency Operations Division as a lieutenant on Truck 4, which is the PSU fire station. Alan holds a Bachelor of Science degree in Fire Service Administration. Joanne Fuller currently serves as the director of the Multnomah County Health Department. In that role, she oversees the county's clinical system, which is the largest primary care system in the state, serving only Medicaid and uninsured individuals. She also oversees the county mental health system and the public health division. Ed Blackburn has been the executive director of Central City Concern since 2008. Central City Concern is a nonprofit agency in Portland that is committed to ending homelessness and helping people achieve self-sufficiency. He's also a founding board member of Health Share of Oregon and Oregon's Health Co-op. He currently serves on the board of Downtown Portland Clean and Safe. Our moderator, Cheryl Myers, directs operations, communications, and several other areas of importance at the Oregon Higher Education Coordinating Commission. She previously served as the Director of Economic and Business Equity on the Governor's Cabinet. A lifetime Oregonian, she's deeply committed to the community. Please welcome our moderator and panelists here today. To kick things off, I'd like to invite to the podium City Commissioner Dan Saltzman, who oversees Portland Fire and Rescue.
Well, thank you, Courtney and City Club, and I'm honored to be here today to formally introduce our new chief, Mike Myers, to the City Club audiences. And I'm the one that hired Chief Myers to be chief, and Chief Erin Jansen's, when she announced her retirement in January of this year, we launched a national search for her replacement. And we had many fine candidates apply for the job. From all over the country and from within Portland Fire and Rescue. And Mike Myers went through an extensive interview process, not only with me, but with other citizens. And Mike rose to the top. And that's why he is now Portland's fire chief as of June 30th. And we chose, one of the reasons we selected Mike, and I chose Mike, was his extensive background at Las Vegas with emergency medical service issues. And our firefighters, the men and women of the Portland Fire and Rescue Bureau, embody excellence. They embody excellence in fighting fires, protecting lives and saving property. They embody excellence in providing emergency medical services. They embody excellence in providing emergency response and thinking about emergencies and planning for emergencies. They are there when we need them. But one of the things that is apparent to all of us, and this is happening across the country, is that fire and rescue departments are increasingly responding to medical calls. Over 80% of the calls Portland Fire and Rescue responds to now are medical in nature. So we need to think about that. We need to think about how do we play a role, Portland Fire and Rescue, in the public health safety net. And that's one of the reasons I chose Chief Myers, because I know he's a great thinker, and I know that he's a great doer on issues of change. And I think this is a period of change for Portland Fire and Rescue, and I think we have a great leader who's going to lead us through those changes. And with that, I'm pleased to welcome Chief Mike Myers to Portland.
Well, thank you, Dan, and thank you, City Club members, for having me here today. It truly is my honor to not only be here and speak today, but be a representative as a public official for the great city of Portland. When you leave a home and you decide that you're going to relocate and you're looking at a new place to live and do a different occupation or maybe a new job, the first thing that you do is you look at where you're going to live. And Tara, my wife's here joining me today, and when we looked at all the places around the country that we might want to relocate to, what stuck out for us in the city of Portland, and it hits a lot of our boxes, was the walkability, the vibrance of the community, the energy that Portland has, the access to healthy foods, the access to good health care, all the great things that make a great city. And we've relocated here. Of course, we live in the downtown area, so we can be a part of the fabric of the community. But those things are very self-evident to us. Portland is a fantastic community. And I think we all know that, right? It's Portland. It's a fantastic location. But the other interesting thing when you're evaluating where you want to go is how will it align with the occupation that you're going to have? And although Portland has this amazing fabric to it, and as a community and things work here, the transportation works, it's a beautiful community, it also has some serious social health issues that we're facing. Not unlike many large urban cities across the country, but there are some unique things here. So when I looked at the social health issues of what Portland was facing, what the city had for it, and looked at what the department was doing today, the professionalism that has been showed and displayed to us already since I've been here, it is perfectly aligned to be a critical and key player in solving some of the social health issues of the community. It is truly the next step for the fire industry in general, not just Portland Fire and Rescue. And it's going to take not just leadership from the fire chief level, but leadership from people like Alan Ferschweiler and Local 43, and then the membership of the organization to across the board with all the firefighters. It's interesting today, I think the panel is a unique selection of individuals that have key interest in social health. I do believe that's the fire department is positioned interestingly to solve some of these issues, because it's where we often turn when we don't have answers to our issues, is right back, who can solve these? And oftentimes the fire department is there to help. I have a critical mission beyond our mission as the fire department here in Portland to save lives and property and the environment. And my personal mission has been and always will be to assure that every resident, every Portlander is healthy and safe. If that's my true mission, if I truly lay awake at night and worry about that, then I have a lot ahead of me to figure out. And it's going to be done with partnerships with key people that are right here in the room today. So it's one of the reasons I really appreciate being here, is the opportunity to meet all of you, the opportunity to be before you and answer questions. And I want to tell you how wonderfully thankful that Tara and I are for the extremely warm welcome that Portland has already given us. So thank you.
For our OPB listeners, you've tuned in to City Club of Portland's Friday Forum. I'm Cheryl Myers of the Oregon Higher Education Commission. Today we're discussing Portland Fire and Rescue, the bureau that works or does it, along with Portland's new fire chief, Mike Myers, Portland firefighters Alan Ferschweiler, Multnomah County's Joanne Fuller, and Ed Blackburn from Central City Concern. Thank you so much to all of you for joining us and our audience in person and our OPB audience. Tara, we definitely want to extend a warm welcome to Portland to you as well. And perhaps later, another time, we'll learn more about your kissing travel blog. But for now, welcome. Chief Myers, as you mentioned in your opening remarks, every person healthy and safe. Could you expand on that just a little bit for us?
I can. So it is a unique perspective. If you're going to be, I'll look at it this way. If you would have asked me 200 years ago, what are the challenges a fire chief faces, I would have told you, well, the buildings, the cities are burning down in urban areas, right? People, they're losing large swaths of buildings, and we need to figure it out. And so fire chief's primary responsibility was how to protect the public from fire. And those fire chiefs and the fire industry worked with engineers, people that understood the layout of streets and constructed buildings, and code officials and private sector to really solve the fire problem. And today it's manageable. We still have fires, but it's manageable. And so my perspective has been that cities are still on fire. They're not burning down from fire necessarily, but lives are still being affected. Businesses are still being affected. And they're being affected from a social health perspective. So as the fire chief, it may not be the red stuff, the fire, that's hurting our citizens or destroying jobs or growth, but it's health issues. So my role as the fire chief, I believe, is to hinges specifically on the role of health of the public. And 80% of call volume today in the fire service is medically related. Not always in advanced life support situation. It's oftentimes cardiac arrest, heart attacks, stroke, trauma, but also we're in people's homes for the average humanitarian need of the public. And these firefighters are there 24 hours a day, and oftentimes a lot of their work is done just in people's homes, helping them get through life. And so I do have a responsibility, although the name says fire chief, and the name is a firefighter, it's a lot more than fire today.
Yeah, there's a lot of things on fire today in the public domain. And I'd just like to open a conversation with all of our panelists just to discuss, where are we headed and how, in light of this, how do we address how a 21st century Fire Bureau should serve our city? So I'd welcome any comments from any of you.
Sure. The Chief, Central City Concern provides about 26, we house about 2,600 people every night in the city of Portland in the lowest income housing possible, lowest income tenants that we have in the city, many with a lot of difficulties. We also provide healthcare services for people with high acuity healthcare issues. Specialty mental health services we do for people who have serious persistent mental illness, and addiction services. And we also do employment services. When I think of what I see in over 26 years of working with partners, including the Fire Bureau, and what your personnel are dealing with increasingly over the years, we see more people coming out of secure mental health facilities ending up on the streets. We see people coming out of the correction system now as they're trying to downsize and control costs without housing, without a lot of options once they get to the streets. We're seeing a lot of people migrating here for some of the same reasons you talked about. It's a very lovely place to live, and that brings all kinds of people, and we're expecting another 200,000 people over the next 15 years is what I hear. How do you prepare your workforce for that, given what they're already dealing with? But in terms of training, what's the future of your workforce, and what do you see in terms of their development and engagement in these issues?
And I'm going to let Alan answer in a second too, because Alan and I have talked a little bit about what you've experienced, Alan, since 2001, because I think that's important for them to hear what's changed from a firefighter perspective. I'll tell you this: the federal government and the state government at some point is no longer able to support mental health like it used to when I started as a firefighter. These issues were still prevalent, but they weren't this prevalent. And, everything has become local. And we're looking to the local officials to figure it out. And so I think the key thing, Ed, in what you describe is that the fire department is not going to be able to do anything alone, right? The solutions must be connecting with agencies like yours and developing these partnerships at the local level, right in what we call fire management areas, those run areas and that the fire stations are in, and linking advocacy groups, nonprofits with the client to really help them with the services that they need. And when we see that start to work and the performance measures are getting better, that's when funding can be probably made more available, and that's the theory. And so that's what this is about. So it's a lot about educating firefighters. I don't have to do a lot of education with firefighters on this issue. They're the ones that, as I went through the fire stations, they're the ones telling me, look, Chief, here's what we're facing. All our options is to take them to the emergency room, which is not a solution. Can you help us? And so, a lot of this discussion that we're having now is, yes, there are a lot of people out there ready to help from public health and from advocacy groups. Let's start linking them with the right people. And I don't know, maybe Alan, you can help us kind of understand what you're going through as a firefighter from 2001. The job's changed.
Thank you, Chief. Yeah, I went through Chemeketa Community College in 1995, and they taught you a couple things. They taught you how to fight a fire. They taught you how to do emergency medical service. I was hired in June of 2001 here in Portland Fire and Rescue, and so my employment started in a world of the fire service before 9/11 occurred. And so a lot of things have changed for the average firefighters that work here. One, in 2001, we were going on about 52 or 53,000 calls a year, and we're up close to almost 80,000 calls in that short time period. And so the percentage of fires are actually going down, but what's amazing is the actual number of fires we're going on is actually really, really constant. We're going on the same number of structure fires every year. It's just that percentage going down because we have 30,000 extra calls in it. So it's interesting to set that context there. But since 2001, there's been a big shift in the fire stations, and there's been a lot of things that's happened nationally. So 9/11 was one of the biggest things that's happened in my career. It'll always change people that worked before that time period. There's things that never happened before. We never had Columbine. We never worried about having to respond to Orlando, where 50 people were shot and killed. We really didn't have to worry about the big earthquake. It was always there, but it was never something that was forefront on our mind. And you look at those type of emergencies that keep happening. Again, the homeless camps on Springwater Trail that are burning right now. Those are issues that continue to progress as society progresses quite quickly that the fire department is trying to catch back up to. So in terms of training, again, when you look at, and I've been a paramedic for 19 years, we did not have the mental health training that we need for some of the paramedics that are in the community colleges now. It's becoming a larger issue, how to deal with them, how to correctly de-escalate the incident, which a lot of people and we want to do. I was just on a call at Pioneer Square, and we waited for about 35 minutes on a call, and I was on truck 4 waiting for the ambulance to code 1, and it was us and the police, and we just allowed the person to do his thing. And somebody in the back yelled and said, "Why aren't you guys doing anything?" And the answer was, we are. By waiting and being patient, we are doing what's best for that patient. And then we were able to de-escalate and put in an ambulance and go. Now, some of the small stuff that we were doing as a bureau is, and if I get on a call and I have 4 people on my truck coming in, and it's a medical call that we believe that the ambulance can handle, we have the ability to go back and service quite quickly. And so I can go on the radio and say, this is truck 4, put me back in service on scene, and then if we get a cardiac arrest or a fire or a motor vehicle accident, we can quickly get free from that call to be able to do it. And that's just trying to deal with the straight number of calls that we have each year. So I think for me, that's how I see things changing. We have a response system that's very good in many ways. We have one of the highest national save rates for cardiac arrests, and we need to thank you. And built upon that emergency response, it's great. We meet people. It's amazing. One of my friends worked at Station 19, and he told me, he goes, it knocked on the door, and this guy comes up and says, "Hi, are you Phil?" And he's like, "Well, I am. Who are you?" And he goes, "Well, I could lay on the ground and act dead and see if you recognize me." And a week before, he was in full cardiac arrest, and a week later, he's walking up to the fire station to say thank you. So again, it's a big challenge that we have through training and everything that we're doing. I believe we're well suited to meet that challenge.
Nice. Joanne, some partnerships currently exist between Multnomah County and the Bureau. What other, in light of this conversation especially, what other possibilities do you envision? You know, transporting those in mental crisis and et cetera. I'm curious your thoughts.
So, as we're having this conversation, I'm thinking about a few things. One is all of our systems need to figure out how to interconnect in a deeper way. We're dealing with people who have multiple levels of problems. They may have basic needs issues, they may need housing, they may have healthcare issues, they may have mental health issues, and one group alone can't address those. At the same time, we also know when we deconstruct the statistics in our systems, there's a small number of people who are really responsible for a lot of the calls for assistance. So a relatively small group of people really drives a lot of the need and a lot of the work. And so I think part of the challenge for us is figuring out how to pay attention to the data we have and deconstruct it in a way that we can figure out where we get the most benefit from attacking issues, because it isn't a one-size-fits-all, and we know that the need is driven by a select group. I think the other thing that I think about here is how, as we have these systems that are more complicated, where people need to work together across systems, how do we both continue to protect the excellence at the core job? You folks are excellent at your core job of addressing those traumatic events and responding to them quickly and life-saving in that situation, while then being able to figure out what's the area of influence and mutual responsibility that you have then with other systems. Because sometimes when we try to grow too big too fast, we lose that core of excellence that we had. And so I think since what the Fire Bureau does is so critical, we need to not have that happen. So part of what my kind of question to you all is, you know, what are your thoughts about that? How you preserve that excellence and then do other things?
For our OPB listeners, you're tuned in to City Club of Portland's Friday Forum. I'm Cheryl Myers of the Oregon Higher Education Commission. Today we're discussing Portland Fire and Rescue, the Bureau that works or does it, along with Portland's new Fire Chief, Mike Myers, Multnomah County's Joanne Fuller, Portland firefighters Alan Ferschweiler, and Ed Blackburn from Central City Concern. So it was a great question, Joanne. It looked like Chief Myers had a response he was ready for.
Yeah, I appreciate the question because it was interesting that you asked that. We were in the process of actually hiring a new division chief. We have some vacancies. There's been a lot of retirements in Portland Fire Rescue Bureau recently, and so we are at a pivotal moment where we're going to do some growth. But you know, part of the discussion that I'm having with the people that I'm interviewing with is, you know, when we visited the fire stations when I first got here, I've been here for 2 weeks, and the first day I was here, I think Commissioner Saltzman pinned me on a Thursday. We were in fire stations on Saturday, Sunday, and Monday till about midnight. We were out on with the Marine group and really talking with firefighters. It was profound for me to experience the professionalism that these individuals display. And I wouldn't, if I didn't think that, I wouldn't even say it. It was just moving. And I've been listening to the radio on how tactically and strategically competent they are. And so the same thought crossed my mind, not just for this, how do we move into a more humanitarian type view set on the way we're providing medical care, but because of all the retirements and the potential change that we're going to be facing, how do I continue this professionalism that we've established, what makes Portland Fire, because there's an element of tradition there that we cannot let go. You know, I want to bring modern business practices to the traditional industry, but when you're doing that at the same time, I do not want to leave what has made Portland Fire and Rescue Bureau so professional. I don't want to lose that. So they've, you know, if you kind of watch how they work and you talk to the firefighters, what I found is most of them will tell you it's in the unique training that they have. And it's a very unique way that they train a firefighter from a trainee and then put him out onto the floor, the fire stations, I call it the floor, and then how they continue the training from there. And that part of it is very robust. It is very unique in the industry, and probably, in my opinion, needs to stay, a consistent part of the way we do business. That way, we don't lose our core. Because the fact is, I think Alan said it best, is the fire load isn't dropping. It's just percentage-wise it's going down because we're getting so many more medical calls. The fact is, we need to be prepared for so many things. When the community calls and says, there's an earthquake, they're going to turn to the fire department to handle it. When there's been a shooting that's unprecedented, they're going to turn to the fire department to handle it. When there's somebody stuck in a hole, stuck in the river, a building's on fire, a high-rise is on fire, people are sick, they're going to turn to the fire department to handle it. And, we've had a history of, we'll figure it out. So you look at a firefighter dressed up in a firefighter uniform, the fact is they actually have 8, 9, 10 uniforms that they wear every day. And they just pick up a different bag of tools for every different thing they go to. And there isn't one thing. You can send a firefighter on whatever the next thing is going to be, because we're not done yet as a society. As a human society, another type of issue will come up, right, that we're not even thinking of today. I can guarantee you that people are going to be looking for the fire department to fix it, to figure it out. So one of the things that is consistent in training is we've got to train. These are just normal people like you and I that, we come to the Rookie Academy. We've got to train individuals to think on their feet, to be nimble, to not be afraid to be innovative, to be early adopters, and have the courage to move forward. That's why when we're talking about change, is the fire department ready for change? Does it work or does it, right? We are training individuals from the base level to be ready for to change, to do whatever we ask them to do. That's why we've always been uniquely set to take on new things. And that's why it's always interesting is whenever something new comes, I put it on their lap, they figure out a way to do it, and we try to support them and get it done.
So from an innovative and creative solution perspective, be interested in ideas that each of you have. There's such intersectionality of the complex issues that face the Bureau today, and whether you see some things that perhaps should be under consideration. Chief Myers, your experience in other areas, what are those things that could really move us forward? Alan?
And I'm going to talk about some of the issues or some of the programs that we actually are working with Multnomah County with. And one of them is called the Community Health Assessment Team. And so this is where a Fire Bureau paramedic is matched with a Multnomah County employee. And so one of the things that they do is they go out on high-frequency callers. And so one of the issues that we have in the Fire Bureau is that we'll go out, again, I'll go out on a call, we'll go with the ambulance, and we'll go to somebody that's having an emergency. The easy thing for us to do is put in an ambulance and take them to the hospital. Not the right thing for that person. They're not going to get the definitive care. They're really only going to get the Band-Aid for what's wrong. And so one of the things that we've been trying to do is assess that person and decide where they need to go. So the community health team, along with what's called an alternative destination, alternate transportation program, allows me as a fire lieutenant or a paramedic to be able to ask the person, do you want to go to the hospital, or can I put you in a taxi and put you to a clinic? And so as we move and we look at where I think a lot of the things and the changes that could happen, it's trying to find the definitive care for those that are calling 911 that's not always the emergency room. And even further, it's how do you stop them from calling 911? And the fire chief talks about the community health. That's a great example. How do you get that person to have definitive health before they have to call 911, and using us as a healthcare system and move from there?
Great. Another program along the same lines of really looking at frequent users of the 911 system for the Tri-County region, Washington, Clackamas, and Multnomah County. At Multnomah County Health Department, we run a program called Tri-County 911. They take the highest level callers to the 911 system, oftentimes people who are calling multiple times a day, if you can believe it, and they send social workers out to where they're at. Sometimes those are homeless camps, sometimes they're low income housing. Sometimes there are other places, and really work with all of the folks who are involved with that person, including the Fire Bureau and other folks, to figure out what's the best possible plan to get upstream of that person's needs, as opposed to every time they believe they're in crisis, oftentimes it's not a real medical crisis, that they're calling 911. And that's been a hugely successful program. And so I think continuing to mine down and figure out who are the people whose needs are not being met by the existing system, and figuring out those kinds of innovative strategies for addressing their needs is really what we need to do.
And I want to follow up on that line of thinking, because I think some really interesting, really great things have been put in place in the last few years around the whole notion of coordinated care, and what Joanne and Alan have talked about are two good examples of that. But there are still people that tragically are on the streets. And the other day I was taking a walk in the afternoon. My office is in Old Town. I walk up to the waterfront, see what it's been like. I had some free moments. Actually, it was not as bad as it was last year in terms of homeless people in the waterfront area. But on the way there, and unfortunately this is not an unusual experience, you know, I saw 3 or 4 people that were so demolished in terms of their mental health, their spirit, their physical condition, that is shocking. And I've been at this for 26 years to see that. I can see in my mind's eye right now a woman that was in Old Town sitting on a wall. Is probably in her early 50s. I think she was Alaskan Inuit, and she had everything she could wear bundled around her. She had that 1,000-yard stare in her face. Nobody was speaking to her. I saw another man squirming on the sidewalk, filthy, looked like he'd been out there for weeks, maybe longer, repeating, I need to stop kicking myself in the mouth, and laughing and then crying. It would be shocking to most people in this community to know that those kinds of people cannot be committed on an involuntary basis. And when I took that walk and came back, that woman was still there, and I said to myself, my God, what's going to happen to her tonight? So in terms of this coordinated care, I'm not trying to put that problem on the Fire Bureau, but it is a community problem, and you play such an important role. How do you see the Fire Bureau interacting in some of these kind of really hard cases when we're coming up against institutional barriers? How do you see the Fire Bureau working with community organizations like Central City Concern or Multnomah County to solve some of these hard cases? And we should not, at this time in human history in this country, seeing people on the streets like that.
If I may, because I think you raised a really good point. The mayor actually had a meeting just yesterday, I think, and it was talking about some of the state emergency stuff around homelessness. And the conversation was a lot about the reactive nature of where we're at right now and how we're servicing that need. And so I'm going to comment on a couple of things quickly. The first item is, and this is my own personal perspective. Granted, I haven't been here very long, so everything, I'm talking about an anecdotal thought here. I really believe that for every homeless individual that we see, I would think that by multitudes of 10, there are individuals that are on the verge of becoming homeless, right? So, and we see them in their homes all the time. These are individuals that are in poverty. They have serious health concerns, mental health or not, and that they're on that thin veneer at that tipping point before they become homeless. So one of the general discussions needs to be how we create health in our policy and how we focus on that upstreaming, Joanne, that you talked about in trying to stop that swing of patients into homelessness, right? And I know there's also some migration of homelessness across the country and those kinds of things. So that's one area where I really think we should think about investing time, dollars, and the commitment from the Fire Bureau in helping to solve that and link those individuals with the appropriate clients or the appropriate advocacy groups that have the funding and that want to do that work. And that can be done at every fire station level, right? So the second thing is, just like you addressed, Ed, now what do we do about those individuals that are already in the circumstance, right? So which is no easy solution. Right now, the best that our firefighters can do, and I heard this across city agencies. These are, just employees with the city that may be interacting with individuals on the street, whether it's the Parks Department, or it's a ranger, or it's a police officer, or it's a firefighter. People that are doing cleanup, people that are trying to offer assistance, people that are in the policing, or in a firefighter that's there to help. We don't have any solid answers on what we can possibly do with these individuals at the moment, other than link them with services that may be able to provide some kind of temporary housing. And even there, my understanding, there's a choke point of services that are available. I think it's one of the things that our commissioner faces all the time, is the challenge of so many individuals, and what can we do? Where can we put them? And so, I've come from a large city in Las Vegas. Tara and I spent a couple of years in Chicago, so I'm familiar, and we traveled a little bit around Europe. So we've seen homelessness in other countries. We've seen homelessness in other urban cities. The homeless issue here in Portland is different. It's at a different stage, at a different quality. And I thought, Ed, you described it very well. The homeless issue here is when you interact with some of these individuals, they're at a level that is so low in the human scale that it is sad. And it moves you to try to do something, and we don't have any answers at the firefighter level. Remember, we're dealing with 24-year-old young men and women that we give them as much training as they can, but they still, even me as a resident, as I walk through the streets of Portland every evening, I live downtown, I interact with these individuals all the time, I don't know how to interact with them. So it's that basic human interaction and what steps we can take as a community to solve this homeless problem. Because you're right, it's not going to end up on the doorstep of just one advocacy group to solve. It's not going to end up in a commissioner's office to figure out how to fund one shelter. That's not going to solve the problem. And it's not going to be the Fire Bureau that's able to pick up and ultimately solve this individual's long-term chronic issue. And the other thing we need to understand is we have to be patient, because this is not going to get solved by Thursday, right? We're at a stage now at the magnitude of the problem that it's going to take potentially years to solve. And so I appreciate the question, and as I interact with firefighters, they've said the same thing to me. A lot of them are looking at me for solutions, and they're looking at Alan from the membership side for solutions, and we don't have any good answers for them.
Well, darn, I was hoping for some great answers.
Well,
In fact,
actually,
Alan,
I just want to,
Sure.
just for thinking purposes, I think we do need a special facility for people in this condition, that we can identify these people, do the interventions, and get them in. It would be great to have the Fire Bureau advocating for something like this. I think there is issues around involuntary commitment and the criteria that we have to approach. Now, the advocates that were behind these changes around the criteria are, I consider to be allies of our patients at Central City Concern, and therefore our allies. But some of these things have gone too far, and it's too hard. And to see somebody suffering like that and have institutional barriers to get them the care they need, it's not unsolvable. But as a community and leaders in the community like the Fire Bureau, alongside others, can maybe get some stuff done about this.
I will say one quote that I thought was important. I had watched a TED Talk the other day of the young lady. I think she was the president of Costa Rica at the time, I believe, but I was able to get the Paris Climate Act done. And I thought she gave a fantastic quote that the word impossible is not fact. Impossible is an attitude. And I agree with you, Ed. This is not an impossible thing to fix.
Before we move on, Alan, I just had a question. So how do you see labor collaborating, and what do your members need as we talk about these really thoughtful and innovative solutions?
Yeah, and if I can hit on Ed's
Sure.
question first as well, and I think you've actually got a really good point, because we do have the Unity Center that's getting ready to open up in the next 18 months. And so that is going to help a lot with some of the mental health issues out there. But the concept of Ed, which I see being, is a middle ground between the Unity Center and a hospital. And we go out on patients, and multiple types of patients, but there's sometimes we go on a homeless person and we ask them, what do you need? I don't know. What do you need? I don't know. Well, I know you don't need to go to the hospital. I can tell you usually in about 30 seconds to a minute if you're a critical patient. Just from 20 years as being a paramedic, we're trained to know if you're a critical patient. We know you need to go somewhere. And so we'll try and send them. The mechanism isn't quite there, but we'll say, can we send you down to Bud Clark Commons? Can we send you somewhere else except send you to the hospital? And it's actually really linking all those together that'll help us be successful in there. One of the other things that we need to do, and we go on patients, and you would be surprised at how many, and we've done a really good job with getting the veterans off the streets, but there is a lot that we still go on, and we ask them, we look at them and go, where do you go to the hospital? Veterans Hospital. It's red. What kind of mental health care do they do? What kind of addiction services they do? Because we still see a lot, not as many as we did 3 or 4 years ago, but we still see a lot that we've caused by society of sending people to war and then not fully taking care of their social and their mental health issues when they come back. So, and would you mind re-asking? Sorry, I was...
No, I was just wondering how you see labor collaborating, and what do your members need as we address these solutions?
So, in speaking of, and specifically what labor needs, is labor needs a clear, transparent conversation about what the city needs, what the county needs, what all the stakeholders need. And that's really what we need to have buy-in for these type of programs. And so we, as a union, and as in any union, we really worry about working wages, working conditions, and that's what we're talking about now, in hours. And the working conditions that we do are very, very important to us. And so we are very open to innovation, but the line in the sand that we have really is, do we hold the line on the emergency response units? And that's very, very big to our union and to our members, is that we see that we have a emergency response system of X number of 4-person companies, which are engines and trucks, and we don't want to see those critical resources brought down to be able to deal with some of the other issues. We see those 4-person companies as truly the emergency response. They're the ones that take care of the heart attacks, the fires, the MVAs, the white powder that's in the letters, and we, as a whole, all of my members tell me very consistently, don't let that go.
Sure. For our OPB listeners, you're tuned in to City Club of Portland's Friday Forum. I'm Cheryl Myers of the Oregon Higher Education Commission. Today we're discussing Portland Fire and Rescue, the bureau that works or does it, along with Portland's new fire chief, Mike Myers, Ed Blackburn from Central City Concern, Portland firefighters Alan Ferschweiler, and Multnomah County's Joanne Fuller. Just to pivot briefly, Chief, I'm curious, what will be your parity and diversity platform priorities for Portland Fire?
It's a good question. So it is pivoting. I'll tell you what I found when I got here. That when you first arrive to an organization, you have a unique perspective. It's that fresh look from the outside that you get. So and people from the inside, from an organization that's been there for a while, may not necessarily be able to to look at themselves differently. But somebody that comes from the outside, you get immediately a fresh look. And so kind of here's where I'm at, and I think this is important for listeners to understand and have some confidence going forward on how does the fire chief operate. So I know that I'm responsible for writing a certain amount of health policy for the community, right? And so I work with a very talented group of division chiefs and deputy chiefs that help support me to do that. So when I sit at a division chief level and I look around the table and we don't have a great deal of diversity at the level, but I'm still responsible to write health policy for the whole fabric of Portland, which is a very diverse group, then we need to have something in place to make sure that that policy meets the needs of the entire community. Okay. So how I do it is I have what's called an equity committee, and that equity committee reports right to me. And this equity committee, I actually just asked the young lady the other day to start working directly for me. We established an equity committee specifically for this purpose. And this individual, as I write policy, all my policy before it goes out to the community and becomes policy for either how we're going to operate here at Portland Fire, or it's something that the community will work with. We'll go through the equity committee with their eyes on it, framed up from their lenses, so it can meet the needs of the community before it comes to my level, before I'll sign it. And so I'm hoping that that gives some level of confidence to the community that we're getting multiple different views on policy in Portland Fire Rescue.
And the committee is comprised of?
The Equity Committee has about 4 or 5 individuals, all of different types of a fabric of people, of different genders and races, and ideas and thoughts. And that was the important part, that we don't all think alike and look alike, Chief Myers. We're all different. Because I know that I come from a certain level of experience as a young man. I have a certain lens that I see life through based on what I've lived and what's happened to me and how I've grown up. Not everybody has grown up like me. Not everybody sees the world like I do. And so, as long as I have an open mind to live and learn and love openly, that's a nice value to have. I also know I will never be able to understand everything that happens to individuals and how they view certain things. So it's important that I am open enough to seek those other perspectives, especially from a public office, like the fire chief office or the fire bureau office. And so for me, it also in turn, this is the interesting thing, although I think it's very beneficial for the public to have an equity review of all policy, in turn, it helps me learn and grow as a leader.
Thank you. That's great. So adequate resources are always a consistent concern, and I wonder if we could have just a brief conversation. I understand some new revenue may become available to the Bureau.
Yeah, so one of the things that the Fire Bureau and direction from City Council is that we are one of the few bureaus that really does not generate revenue for the most part. So we do inspections, and we'll go into a building and do inspections and generate revenue from there. But for the most part, all of our fees are free. So I'll go out on a medical call, and we will leave, and that person will have zero bill from the Fire Bureau of the city. We'll go out on a fire. We can go out on the marine fire that was $25 million in damage, and their bill, zero, still zero. And so one of the things that we've heard consistently is that we want to have revenue generation. We want to have the Bureau that can do that. One of the things that we've worked with some of our partners, both with the Oregon State Firefighters Council, with the City of Portland, with Oregon Fire Chiefs Association, is called it's a GEMT bill, Ground Emergency Medical Transportation. And so what that does is that allows the Fire Bureau to be able to get money for Medicare and Medicaid for the first responders services that we do. It's very, very exciting. When we look at a time where revenues are very, very tight for the city, it's a great opportunity to be able to build capacity into our system. I think the estimates that a city or statewide, up to $60 million in revenue for various fire districts throughout the state of Oregon. So you can imagine, City of Portland, 80,000 calls. We are by far the largest emergency medical service department in the state. And so for us, we see that as a very good opportunity to be able to help build capacity and help respond to some of those.
Any of our other panelists have any thoughts on that potential?
So I think that's an exciting opportunity, and also there are some challenges with that. One of the things, those of you who have been following Medicaid and healthcare transformation in Oregon know that we work from a global budget, so it's a fixed cost system where we're then trying to decrease the costs of and utilization of the high cost, potentially unnecessary services, so that we are saving money to be able to apply to lower cost, more effective interventions with people. Ed and I are involved in a lot of committees, boards, and task forces that are deeply involved in this work. And so I think the challenge is figuring out, again, what's the right fit for the Fire Bureau's role in that, because it isn't necessarily a system where there's just where the state gets more Medicaid dollars because the Fire Bureau's bill to Medicaid for that service. It's a fixed pool of money at the state. And I think the other thing that's really challenging is for all of us in that system is that we're also at the same time talking about how do we use those Medicaid resources to do things like pay for supported housing or recovery housing when people are released from the hospital, or helping people with basic needs. So I think it's an exciting opportunity to think about how does the Fire Bureau expand the resource pool for the work that they do and save us taxpayers dollars in Portland, where I'm a taxpayer. And at the same time, how do we balance these other pressures that are happening on the Medicaid pool of funding?
Absolutely. What a great panel. As a reminder, as we move to the Q&A session, asking questions from the floor is a City Club membership benefit. If you're not a member, there are index cards on the table to write your question. Please hold it up, and staff will come collect it. We hope to get at least one or two of these index card questions to our panel. And please be concise in your questions, as we'd like to get to as many as possible. So, looks like we have Ed.
Edward Hershey, City Club member. Chief, welcome to Portland. It's good to hear that you've chosen to live in the city. You spoke about the need for the Bureau to serve a diverse population. We hear this question asked of police a lot, but I wonder about fire bureaus. Does part of the training of both in service of new members of the Bureau involve cultural competence and implicit bias? And should it? And I'd love to hear not only your take on that, but Alan's as well.
Great question. So first of all, it's extremely important question. The solution for like equity understanding, understanding the fabric of the community and how to deal with the community starts long before the academy or teaching an individual those things. It starts with making sure that we are interacting with the community in the way we have our recruiting efforts, the way the fabric of the Portland Fire and Rescue Bureau compares to the fabric of the community, and that helps with those types of things. I'm new here, so I'll let Alan ask on what kind of, or answer on kind of what training that we do offer, but one of your questions also was, is it important? And the answer is yes. So, you know, the calls come in for service at all hours of the day, all hours of the night, 24 hours a day, 365 days a year. And firefighters are under an immense amount of pressure to deliver the absolute best service at all times. And we're talking a consistent level of customer service excellence. In order to do that, they really need to be able to communicate with the public in unique ways, regardless of their personal race or gender or understanding of life. They may be in a home where it's completely opposite. And then how do they communicate at a human level? And largely, that's why we're traditionally, when you choose the fire service, that's why you're here. You know when you sign up is you're a civil servant and you're here to serve and you want to give back. And we want to keep that energy from the day we hire that individual. We're super excited to have them that day, and they're super excited to be firefighters, and we want to keep that energy and throughout their career. And I think that's the challenge, right? As they learn and they live and they grow, that they don't become biased, they don't develop a bitterness, that they are still the same civil servant, that same energy they had from the day they hired on.
Thank you. And we do have mandatory training that all of our firefighters go through to deal with those type of issues. They're presented by Human Resources in their mandatory training. So yes, we do have that training. But both as a bureau and as a union, I wanted to take the moment and just talk about what is acceptable and not. And we have a zero tolerance issue for any type of discrimination. Now, we do have 700 employees. Do things happen that we're embarrassed about that happen? Absolutely. But when we have those issues, both us and the Fire Chief Administration, we deal with those, and we deal with them quickly. And as our board, as the Firefighters Union, we absolutely, along with the Fire Bureau, have no tolerance for that.
Great. Next question.
Hi, I'm Tony Tabora Roberts. I'm a City Club member. You touched on two aspects of the makeup of the workforce of the fire department. You noted that there's a lack of diversity in the leadership levels, and also the need to recruit more diverse workforce in general. Can you talk more specifically about your recruiting practices and how you might be changing or thinking about strategizing to diversify the workforce, but also how do we help create more leadership at the top of the workforce in order to kind of help support the diversity?
That's a good question. And Alan, I don't know if you can help me with the trainee program. I know we have a path, this is relatively unique. And one of the nice things when you bring in a chief from the outside is I can bring in different perspective. But also when I come here, I learn things that we're doing great here in Portland that we weren't doing in other fire departments. And one of them is that a trainee program. Most fire departments around the country, at least the ones that I've been involved with, I've been involved with 2 others, but I know a lot about the fire service across the country. The challenge is that the fire departments typically do not look like the community, right? They don't demonstrate the same look and feel of the community. And oftentimes, that's the problem is they simply don't hire directly out of the community. People are required to have an EMT license or a paramedic license, which means they had to go to college, and they have to have a firefighter 1 and a firefighter 2, which means they had to have achieved some certification in a fire academy. That means when you hire somebody, you're only as diverse as the graduate pool, right? And so if you have the economic stability and you have the opportunities to go to those places, then then you would be hireable. That is not always the case here at Portland Fire and Rescue, and they have a program, the trainee program. Are you familiar with that, right? So I think Alan can comment on that. It gives a unique opportunity for those that may not have the same economic assistance that we may have in the room. The second thing is, and I'll answer your second question on what am I doing to assure that we have diversity at the executive staff level. And so as a fire chief, I get to take certain liberties, and I have exercised a couple of liberties. And one of those is I get to invite who I want on the executive staff. And this doesn't mean everybody's getting a promotion and is now a chief, but I do get to make sure that the executive staff is represented in a manner that I believe is appropriate. So I have a handful of my executive staff here today. Jay Gao is here, Ken Burns is here, and Nate Takara is here. Those 3 gentlemen work very closely with me. And as they'll attest, our first executive staff meeting was last week. We've added 4 other members to our executive staff meeting. 2 of those individuals are people of color. One of them is a female, and the other one is a human relations individual. And those individuals help us create good conversation in that executive staff meeting, so we're having good conversations, and the ideas that we come up with are looked at through multiple lenses. And for your confidence, that's just one step that I've taken the first week I've been there. Alan, on the trainee thing?
So Portland is unique in that we do have a trainee program where you can go off the street and become a Portland firefighter without going to school to be an EMT, a firefighter, or anything. You could be 18 and just think, I want to be a firefighter. And you have the ability to come into our bureau and actually be a firefighter. Very, very unique in that. In terms of the diversity question and asking about where we are at with the top, we're remiss not to talk about in 1980, 1990, we were an all-white male bureau. And as we become more diverse in time, people promote and they promote and they promote and they promote to the top. And so as you see some of those changes in hiring that we did in the mid-90s to now, you're going to see those candidates change. Into the diversity question, though, I think it would be remiss also not to talk about the diversity of the Fire Bureau is one thing, but in the fire service as a whole, we don't have a lot of diversity. And one of the things I tell people is it's not how we practice or how we hire that needs to change. It's getting people into community colleges. I started in Woodburn, and I started as an Explorer program in Woodburn. That's what got me to be a firefighter. And we have to get people knowing early, and we have to diversify PCC and Chemectany Community College and all their fire programs. And then you won't just see Portland Fire becoming more diverse, but every other fire department around us as well.
Great. Well, we have one question from the in-person audience, and it's directed to Joanne and to Ed. In your ideal world, how might the Fire Bureau do things differently or better? This will be our final question. I'm sorry.
So, really briefly, I think it gets back to the point that I made earlier about identifying the populations of people that have the most need, the most unmet need and that are costing systems the most money because we're all responding to them in this very scattered kind of way. And so in my ideal world, we'd have a much closer connection and alignment and clarity of the plans that we have for individuals so that we know what the Fire Bureau is doing and they know what the systems I run are doing and what nonprofits like Ed runs are doing.
We've been able to make some advances through technology of sharing information in the healthcare world. And at the community level, our healthcare clinic now can, through technology, communicate with resident managers of low-income buildings to let them know when their tenants have appointments, for example, get assistance with getting those tenants to come to their appointments, which is a big problem for a lot of folks to remember those appointments. And we've seen that engagement rate go way up. We get, I'm very thankful for the Fire Bureau because we get a lot of help for our tenants from the Fire Bureau. Unfortunately, we have a lot of sick people in our buildings, and so it's not unusual for me to see a fire truck going to one, or emergency vehicle to go to one of our buildings. I think we can make improvements there about the coordination of that incident and what your findings are with our health care clinic, but with also others who are taking care of those people, instead of waiting a month or two to find out that they had this emergency visit. Maybe there are things we can do to attenuate some of these calls and resolve some of the issues with your help.
Thank you. We are out of broadcast time for today, and we'll have to stop for the day. If this program has inspired you to join City Club, you can do so at the registration as you leave today. I'm Courtney Nelson, President of City Club. Please join me in thanking Bobby Regan for coordinating our program today, as well as our esteemed panelists. And again, welcome to the Chief and his wife to Portland. We're adjourned. Thank you.